Hi, my name's Anna. I'm a physical therapist at Mass General Hospital, and today we are reviewing spinal precautions and how to stay safe after your spinal surgery. The purpose of today's video is to review precautions you should take after your spine surgery and learn how to safely position yourself when you begin to move and get out of bed after surgery. What are spinal precautions? A good way for you to remember what spinal precautions are is through the acronyms BLTs. For 6 weeks after surgery, we want you to limit bending, avoid lifting anything greater than 5 pounds, and no twisting of your back. Examples for lifting restrictions include don't lift a gallon of milk, as that's about 9 pounds, but you could lift a liter of soda, as that's about 3 pounds. The goal is to try to keep your back all in a straight line. So keep your ears, your shoulders, and your hips stacked in a straight line. You should maintain your precautions after surgery until your follow-up appointment with your doctor. Why do I need spinal precautions? 1, to help you reduce your pain after surgery. 2, to reduce the motion at your spine so that the area of where they did your surgery can heal properly. And 3, to allow for safe and early movement after surgery. So what positions will be comfortable for me after surgery? One position that you may find comfortable is laying on your back. However, you will want a pillow underneath your knees, 1 or 2 pillows. This will help reduce the strain on your back. Another position that may be comfortable is laying on your side. When you're on your side, you will want a pillow between your knees and 1 pillow behind your back to limit you twisting at your back. Sitting will also be comfortable after surgery. When you're sitting, choose a chair with good back support. Avoid slouching and sit up straight. You may want to consider using a small towel roll or a small pillow behind your lower back to give you more support at your back. You want to try to avoid sitting longer than 30 to 40 minutes. You can take breaks by standing up or walking. How can I safely begin to move and get out of bed? We are going to demonstrate the log roll technique for getting out of bed. First, you want to bend your knees and your hips slightly. Then you want to roll onto your side. Now you want to bring your legs off the bed and push up with your arms to come into sitting. This allows your back to stay in a straight line throughout. Now you're ready to stand up. You can use your legs and your arms if you need to stand. Avoid bending forward too far and try to keep your head pointing up towards the ceiling. Now you're ready to walk. You may benefit temporarily from using an assistive device like a walker. Your nurse or your physical therapist in the hospital can help you decide if this is needed. Walking is one of the best activities you can do after surgery. You just want to make sure that you're keeping your spine straight while you're walking. So once again, keep your ears, shoulders, and hips in a straight line. Now we're ready to walk. There are other common activities that you will do throughout the day where you will need to remember to keep following your spinal precautions. One is when you're reaching for objects. If an object is in front of you, you want to walk up close to that object so that you're not bending forward at your back. If the object is next to you, you want to make sure you turn your entire body so that you're not rotating at your spine or twisting. If the object is down low, you want to make sure you're using your legs, either squatting or lunging, and then lifting up. Keep that object close to your body so that you don't strain your back. Another activity that you will need to remember to follow your spinal precautions is with dressing. If you need to put on your socks and your shoes, we don't want you bending forward. So instead, bring your foot up onto the opposite knee in a figure 4 position. During your hospital stay, you may work with a therapist that can review your body movements with you to make sure that you're continuing to follow your spinal precautions after surgery. As you're preparing for your spinal surgery, review and practice the precautions and comfort measures we talked about in this video. Remember, active movement after surgery is highly recommended and safe. If you have any further questions, talk to your doctor.